Ashlesha, please start.
Good afternoon, everyone. My name is Ashlesha Singh. I study in class 6 and I'm 11 years old. I'm very happy to be here today. Um, I will be performing one of my one of my personal favorites, Aisa Kyun Ma. It will be Kathak based. I have been learning Kathak from the past 6 years and have been learning the same from the past 1 year through online media. Today, my dance is dedicated to my mom and all the wonderful moms in the world. I want to say a few lines on my mom. She is a very blissful and very energetic and the most caring person. I love her very much, and she helps me through everything. She supports me in everything I do. My recently my dance that I love to do so much was not up to its mark because I had been given a lot of work, lot of academic work, so I was not able to keep up with both. But as in every story, there's a hero. There was a hero in my story too. My mom. She came in and helped me manage my time. And before knew it, my dance was as good as before. So, in especially in these tough times, in these times of COVID-19, when everything is locked and things aren't going too well, they still manage to put a brave smile on their face and are multitasking. They're also doing their office work and they're also doing the household chores. So they are doing both of the things together. So we should really thank them and appreciate them each and every chance we get. So in the last, I would conclude with that life doesn't come with a manual, it comes with a mother. Thank you.
Thank you, Ashlesha, for that lovely start to the program. A very good afternoon to all of you. I am Anindita Banerjee, Cluster Head, HDFC Bank, and it is my pleasure to welcome you all on this special webinar program. I hope you and your families are safe and healthy. We are going through an extremely difficult phase as the second wave of this pandemic is creating havoc in our lives. May we all gather strength and courage from each other and emerge victorious in our fight against this deadly COVID. At HDFC Bank, it has been our constant endeavor to stay connected with our customers and their families at all times and always be a part of every celebration. Today, we are here to celebrate a very special day, the International Mother's Day. So from all of us at HDFC Bank, I wish all the mothers attending the program a very happy Mother's Day. Well, we believe every day is a Mother's Day. A single day is not enough to celebrate the worth of a mother who puts her child ahead of herself every day of her life. This day only gives us one more opportunity to express our love and gratitude towards a child's first best friend in the world. Being a mom is a tough job. More often than not, mothers wear multiple hats. They're seen constantly juggling multiple roles with great balance and ease. We believe that being a mother and being an entrepreneur are somewhat similar. Both involve possessing multiple skill sets like multitasking, firefighting, crisis handling, coming up with new ways of problem solving every time, time management, budget management, and all of that. So it would be very appropriate to say that all moms are as skilled as entrepreneurs. And so we have aptly named today's program as HDFC Bank Special, the Mompreneur. We have with us two very special guest speakers who will speak to our viewers in a short while. But before that, I would like to invite Mr. Satyan Modi, Senior Zonal Head, HDFC Bank, to say a few words. Over to you, sir.
Okay, thank you, Anandita. I think such a fantastic start by you and the earlier one. I think, firstly, a happy Mother's Day to all. And as Anandita said, one day is not enough to say happy Mother's Day to all of you. I think it's just a day where we are celebrating, but every day is a happy Mother's Day or is a Mother's Day. And also, I would like to thank all the HDFC Bank customers who have joined on this webinar. Thank you very much for joining. I think a quick brief about your bank, what your bank is doing. We started our journey 26 years back as a startup, as one of the promising startup who wanted to become the India's #1 bank. Nobody would have thought that a baby who's starting its banking inning 26 years back will be able to become India's #1 bank. And today, after 26 years, we feel proud to say, with support of all our customers, that we are India's #1 bank. We are not only India's #1 bank. We are the third biggest company of the country, only after Reliance and TCS, and probably the fifth biggest company of the country in terms of net profit, and has been rated as the best organization to work with, and various other accolades to our credit has come from various reputed agencies. And this has all been possible with all of your support and continued patronage to us. Uh, I think I have a lot of figures, facts to share of HDFC Bank, what we have done in 26 years, but I don't think it is the right time to share all those facts and figures. Couple of things I would like to share, that HDFC Bank is working on two important aspects. One is the digital journey, because all of you understand that digital is the way forward. This era is of digital, and we are invested heavily on artificial intelligence, robotics, and various other digital platforms. And in fact, we are working with a lot of startups also, so that we can make the customer experience, the journey of each transaction seamless, where you can do complete banking sitting at your home or at your workplace. You don't have to visit the branch. And I think we can proudly say that we have reached 90-95% of those level, that you can do complete banking sitting at your home. The second thing which we are very very aggressively working is on the customer experience. Obviously, we are into a customer service industry. Customer is our biggest asset, we understand that, and we want to generate delight factor in each transaction which customer is doing with us. So a lot of work is happening on that side also, that every transaction of the customer, we are able to generate a delight factor. Before signing off, I think couple of things. Let me tell you, I have been in this corporate world since last 26-27 years, and at a supervisory level since last 16-17 years. I think couple of things which I have really liked about the women employees in my journey is, first is, whenever there is a I have been working with large teams, and I have never seen a woman employee coming up and saying me, sir, rate me better, because I have to manage my house also, and I have to manage my office also, whereas the males have to only manage their office, they don't have to manage house. I think I have never come up across any female saying me that. They have always been, sir, rate us fairly, rate us equally with men. What they have done is, do not give us extra bonus or anything extra. I think that is a superlative quality I like about all my women employees, whether they are moms or bachelors. The second aspect which I've liked about women employees in my large experience of corporate world is, I have been fortunate that I have worked with couple of women bosses, and trust me, when you work with women bosses, it is far more enjoyable, because they have that human angle towards it. They understand your problem more than a male boss, because obviously they go through that, and it is a delight to work with a woman boss. And I have been fortunate that I have worked with a couple of women bosses in my career. And the last thing which I would like to say is, banking sector especially, I think, is a great platform for all the women who want to work. I think it is one of the safest workplace to work with, and it gives a lot of good opportunities to women employees. So if you have any women who want to join banking, I think please do not hesitate. Banking is a great career for all the women who want to join the banking industry. That's it, Anandita, from my side. And once again, happy Mother's Day to all, and thank you for banking with us. And we will continue to make your experience with HDFC Bank as enjoyable. Thank you, Anandita.
Thank you, sir, for speaking to our viewers, and thank you for your lovely message. Uh, Now I would like to invite our first guest speaker, renowned doctor, Dr. Abha Majumdar, Senior Consultant Obstetrics and Gynecology Surgeon, Sri Gangaram Hospital, Delhi, to speak to us and advise us on health, both physical and mental health, nutrition, and COVID care. Over to you, ma'am.
Thank you very much, Anandita. Can you hear me?
Yes, ma'am. You're audible, and we can also see you, ma'am.
All right. Thank you so much. First of all, I thank HDFC Bank, everyone working in that, for inviting me for this interesting webinar and the lecture, especially on such a day where I would want to pay my gratitude to my mother and all mothers of the world. And I think I could find nothing better than this platform to speak on women's health, which could have shown my gratitude and what I feel regarding a mother. And HDFC Bank is my bank. I have banked into HDFC Bank since last 20 years. And I know what confidence I have with this banking. In a jiffy, I can open my phone and see, look at all my accounts, see everything. So that is what gives me great confidence about this bank. And I want to pay my gratitude by talking about health and wellness of women on this important day, which has been again assigned to me by the heads of HDFC Bank, Anandita, Mr. Modi, and Mr. Saurav, who has been talking to me all this while regarding this lecture. So when I talk about women's health, I'm just touching upon very important topics which all of you, girls, women, ladies who are working for the bank or any other organization as such would have in their mind. Your general health, your reproductive health, vaccinations. What important vaccinations are there for adult, women, COVID situations, and mental health? So when we talk about general health, smoking and alcohol, we know it's bad, so I'm not going to talk about that. The most important thing I would want to embark upon is eating healthy and exercises, just busting a few myths and telling you a few facts about weight loss. Using medicines, whether they are herbs or pills or any other thing, for weight loss is quite useless. It might give you a very transient benefit, but not a long-term benefit. And there are certain beliefs, like when you age, we just give up and say, oh, aging causes weight gain. No, aging doesn't cause weight gain. Similarly, you eat once a day and you say, one meal a day and I'll lose weight. No, that's not physiological. Human body requires multiple meals a day, and believes that even water will cause weight gain. So I will refrain from drinking water is again something wrong. What is the fact about weight loss is that what goes in should come out and your weight will maintain. If what goes in is less and what comes out is more, you lose weight. And if what goes in and what comes out is less and what goes in is more, then you gain weight. So this is simple mathematics. Saying that I don't eat anything means you don't do anything also, because if you don't move your body, whatever little you've eaten will not be able to be utilized by the body. So one little message, nowadays we are in lockdown, so maybe this will not work very well, but the best is use public transport. If you use public transport, you get 30 minutes of physical activity every day, whatever you may do. I mean, your house may be very close, still you'll get that. And you get 19 minutes of walking daily. So in a small way, you've already busted out some calories of your body, which you might take in your midday meal in the bank, sitting in the bank. But now, since we are all sitting at home, I can show you some programs. Especially Leslie is a very famous lady. She makes you walk in your house in a small room, maybe a space 4 feet by 6 feet, where you can do a good exercise by walking 2 miles in 40 minutes, or in 30 minutes do fast walking and bust all your energy. So while sitting at home, when you get a little time, please follow one of these. You can take a screenshot, go into these programs on the YouTube and use them. My advice for reducing calorie intake without going hungry is eat 3 meals a day, fix meal timings, snacking between meals, a strict no. Maybe you can have something like cucumber or an apple if you're very hungry in between. Added sugar, a big no always, whether it is milk, tea, or coffee. Start with a bowl of fruit or salad in the morning. Focus less on roti, paratha, rice, and bread. I'm just not going to embark more on this because I just came to know there's a great nutritionist who would be speaking more on food and health. So reproductive health issues, well, most of the women around here would have either menstrual problems or concern about fertility, or they need advice on contraception. And the biggest concern is, do I have cancer? How do I find out? How do I prevent a cancer? We'll just go one slide each on these problems. Please pay attention. Having menses between 26 days to 35-day interval is normal. Don't go and consult a doctor or think that you're getting late or early periods. But do not ignore if you do not get your periods after 45 days on a regular basis. When I say regular, every time you get delayed with your period more than 45 days, don't ignore. Take something for it or consult someone. Do not hesitate to take a hormonal medicine to get your periods in time, or maybe a little delayed, say 35, 40 days. These hormones do not harm your body. They are essential for our health. Our body only works because we have balanced hormones inside us. So when we have a little hormone which is less, we need to take from external source the balancing hormone to make it equalize. But if you have irregular long episodes of bleeding, or you have very frequent bleeding, show yourself to a gynae, a doctor, and get the cause treated. So these are few tips on menstrual problems. Delayed periods, only if they are very delayed, learn what is the medicine that you get your periods in time and you don't have to go repeatedly to doctors. Number 2 was concern about fertility. You don't need to seek help till if you are more than 35 years and you are trying for 6 months, more than that, or if you're less than 35 years, try for 1 year. When I say try for 1 year, means unprotected intercourse for 1 year, and the sexual contact has to be at least 2 to 3 times a week to say that yes, you've tried adequately for 1 year. Remember, reason could be in you or your partner also. So don't go alone. Think of him also. And sometimes after all investigations of both partners, we find that there's no reason. But then, whether a reason is found or not, in today's advanced scientific environment, most forms of infertility is treatable. So don't lose hope, go to the right place and you will definitely be treated for this. Next, a very important message I wanted to give is do not refrain from sexual contacts during any type of treatment. Please do not wait for the doctor to tell you that have sexual contact, because this is the only natural way to treat infertility. So please have it without any hesitation, whether the doctor tells you or not. Now, the next question which comes to a lot of girls who have children is contraception. And the 3 most commonly used contraception, you can see in the picture, it is oral contraceptives or condoms, which are barrier devices, or intrauterine devices. Now, these are 3 commonly used ones, but the one which has become very common, especially for working women, is a morning after pill, which is a pill which you just ingest within 72 hours of having unprotected intercourse. But one word of caution, don't misuse or overuse it. There are women who use no other contraception because they think that they don't have very frequent contact. So whenever they have unprotected contact, they just pop in a pill. What does it do? It causes very high hormonal levels in your body, so high that it disturbs the lining of the uterus, so that you can have a untimely bleeding. You can have a very early bleed, you can have multiple bleeds, or you could have a very delayed bleed. The dose of the medicine is 4 times the dose of a single oral contraceptive tablet. So you're taking so much more. Oral contraceptives are most effective form of contraception. Do not hesitate. There is a lot of myth regarding oral contraceptives. They are hormones, but these are harmless, especially if one is not obese and a non-smoker. Last is cancer screening. There are just 2 cancers which we all as women need to screen for ourselves. One is cervical cancer screening, and the lifetime risk is just 0.6%. That means 6 per 1,000 women will get cervical cancer, and if we can pick them up early, we can save your uterus, save your fertility, save everything. So Cervical cancer screening is one thing which starts very early in life. Who needs it most? All sexually active women need it more, and more so for women who have more than one sexual partner. So it has to be done once in 3 years for ages 21 to 29 years. And then after that, once in 5 years is good enough. If all the screening between 1 to 29 years, which are generally about 3 to 4 screenings, they are normal, then once in 5 years. And when you do, this is commonly known as pap smear, but now the nomenclature has changed to LBC. So don't get surprised if someone says you need a LBC. Along with that, human papilloma virus screening is also very important to know whether you are at risk to cervical cancer later in life or not. Second cancer which we need to screen is breast cancer. So these are the two cancers which need to be screened for all women. I'll talk on just these 4 headings. What are the risk factors? Cigarette smoking. So stop smoking. If you're obese, lose weight. Never having a child also increases your risk of breast cancer. Possibly breastfeeding and progesterone exposure during pregnancy reduces the risk. Family history of breast cancer is very important. And you must have heard about individuals with BRCA1 and 2 mutation. A lot of you must be knowing it, especially those who have had history of breast cancer in their families. If you have this mutation positive in yourself or family, then you should go more often for breast cancer screening. And there's only one method for breast cancer screening, and this is the American Cancer Society guidelines, because every society has different guidelines, but this is followed most extensively. Mammography is the only way. Earlier than 44 years, only if risk factors are present. Otherwise, the first mammography should be done at 44 years of age. And then till 45 to 54, it has to be done every year. This is only if the first mammography shows that there could be a risk and you fall into the high risk group by the mammography findings, then you need it annually. And then after 54 years, you can have it every 2 years till 74 years of age. And if we are fortunate enough to live after that, then we can do it on the merits of the mammography. But why, what is the risk of mammography? Why can't we have it earlier? Why can't we have it more often? Because radiation is one problem with mammography. We are exposed to a lot of radiation in every mammography, and we can have overdiagnosis and overtreatment. Now, clinical breast examination is quite a farce, and it will not find out a 2B malignancy, which is in millimeters. Now, you would say, why can't we have ultrasounds? Well, you can have ultrasounds, but then ultrasounds are not as effective screening tool for many reasons, because they cannot see the breast at depth. We can only, if we have a nodule somewhere, then ultrasound is good. You target that area, you target that nodule and try to see it, and you tell how does it look, looks good or bad. But if you have to screen the whole breast at one go, you cannot screen and tell the difference that there is a 2 millimeter area which looks different from the rest of the breast. That only a mammography can pick up. So moving from cancer screening, we come to the third point of vaccination in women of reproductive age. Now, there is only one vaccine for women in reproductive age. All other vaccines have been given to us in our childhood period. Cervical cancer vaccine is a human papilloma virus vaccine. That means it is against human papilloma virus. Like today we are looking against the COVID virus vaccine. This is against this virus. It is to be given, it can be started as early as 9 years up to 45 years. The central disease control recommendation is that it should be given to girls 11 to 12 years old. The biggest advantage is that if it is given before 15 years of age, then one needs only 2 shots, one now and one after 3 months. But otherwise, later than that, you need 3 shots, which are at interval of 1 month, 6 weeks, and 6 months. It also protects against most genital warts, as well as some cancers of the vulva, vagina, anus. And the ideal time to have the HPV vaccination is before, for any girl, the chances of sexual contact starts. I hope you've been able to follow me so far. Am I going too fast? If I'm going, someone can just unmute and say go a little slower. I thought there is a time frame, so I was trying to rush through my slides.
Ma'am, it is absolutely perfect.
Okay, you can understand what I am saying. So that vaccine was for non-pregnant women, the cervical cancer vaccine. There are 2 more vaccines which are used for adult mothers, women who are pregnant. These are pregnancy vaccines. So most vaccines are safe after the first trimester, that is the time when the baby is developing in uterus. And in our country, we still give routine vaccine for tetanus toxoid, and this is given sometime in the second trimester. Uh, Nowadays, it is at 24 weeks, but there is another vaccine which has come up, the Tdap vaccine, the tetanus, diphtheria, pertussis. Pertussis is whooping cough. You see, your baby gets the first vaccine at 2 months of age, which has the triple antigen. Which has tetanus, pertussis, diphtheria. But if we give to the woman a Tdap at 32 weeks, that means 2 months more to go for her delivery, and 2 months later the child would get. So those 2 months of the child's life, this vaccine will protect the child from whooping cough or diphtheria, which are 2 deadly diseases. So nowadays, this has become the norm that we give the first tetanus at 24 weeks. That's just a simple tetanus toxoid, and a Tdap at 32 weeks or later than that. And then if you really want to immune yourself out of tetanus, don't forget to take the third tetanus toxoid after 6 months of this second dose, which would be when you are breastfeeding your child, to make you immune from tetanus for the next 10 years, so that any road traffic accident and all, and you're never worried because you know your tetanus is covered. Another vaccine which is given to women is influenza vaccine. Influenza vaccine belongs to the SARS group of infections, influenza, and every year it changes because the influenza virus also undergoes mutation like the COVID virus, and hence every day sometimes it is influenza B, sometimes A, and sometimes variant of these influenza viruses. Now I come to the COVID situation, and I think this is so important in today's world. I mean, the second wave of COVID, when the first wave of that, there were just numbers about COVID that, these numbers are dying. Then slowly it moved to names, and you knew the names of people who were dying. And then now it has moved into us. We know that our relatives are, absolutely inner circle people are dying. So it's come so close to us. In India, more than 2 crore cases have happened, more than 2 lakhs deaths have happened. World has more than 15 crores of cases, more than 32 lakhs of deaths. So it is playing a rampant sort of mortality all over the world. And we all remember that World Health Organization declared COVID-19 outbreak a public health emergency of international concern in January 2020, and it was declared a pandemic on the 11th of March 2020. India, a country of 1.3 billion, was completely locked down on the 24th of March. And still this is the situation which we encounter. So let us look at what are women facing towards COVID. Women are more vulnerable to COVID. And this is a screenshot which anyone can take. This is on my website, on the YouTube, where you get a lot of busting the myths and facts related to pregnancy in COVID-19 scenario. I will not go into detail, but there are a lot of videos regarding this. Let me come to the current recommendations on COVID vaccine in maternity care in India. Women who are going to be mothers who are pregnant at the moment. Now, at present, the recommendation from the Ministry of Health and Family Welfare, Government of India, state that pregnancy and lactation are contraindications to vaccination. That means you can't take vaccination in these 2 states. Both the manufacturers of Covishield and Covaxin in India also state the same on their product literature. So individual practitioners like us cannot advise vaccination to pregnant and lactating women in India until there is a change in recommendation from the Ministry of Health and Family Welfare, Government of India. But then there is a word to it, and FOGSI is the Federation of Obstetricians and Gynecological Societies of India, and it is the hugest organization in the world of a conglomeration of all gynecologists and obstetricians. Now, what is their statement? This is Foxy position statement on COVID vaccination. Density of population and current infection rates in India are very, very high. A substantial increase in the incidence and severity of this infection in pregnant women in recent times has surpassed all times. Risk of infection in pregnancy, complicating routine pregnancy care and delivery has become very great. In Gangaram Hospital, our labor room is converted into a COVID labor room. Every woman who's entering has COVID. Risk of serious morbidity with infections in pregnancy is going up, as it is going up for other people also. And we know that we have demonstrated efficacy of vaccines available in India. We know these vaccines are so useful. And we also know that for decades we have been giving influenza vaccine to our pregnant women from the second trimester onwards. And these COVID vaccinations are allowed in the UK and many European countries for whatever vaccination is available in their country. So we feel that the government of India needs to revise its statement for prohibiting vaccines for pregnant women, because it is a very, very susceptible period and a woman may face grave damages, not only to herself but to her child also. So we feel that women should receive the vaccine. One is a very important myth which is going around, and I get so many calls for this, that I am menstruating, can I take the vaccine? Yes, you can take it on any day of your menstrual cycle. And vaccines can be given in preconception period or for women undergoing fertility treatment, including IVF. And pregnancy testing before administering the vaccine is not needed. Now, when you say it is not needed, a woman may be pregnant and she wouldn't know. So this statement cannot be made unless the vaccine is safe for the woman who's pregnant. And if vaccine is administered inadvertently to a pregnant woman in early pregnancy, no need to do medical termination of pregnancy. Therefore, our recommendation is vaccine for a pregnant woman already infected in the past. One has to remember that please defer for 8 to 12 weeks from the infection. But if a pregnant woman has comorbidities, she's a diabetic, hypertensive, has other problems in pregnancy, please give the vaccine if it is not contraindicated, but on your own risk, because government of India has not allowed. And we also feel that this vaccine can be given safely in lactating mothers, as other influenza vaccines can be administered. And if we have to say no to a pregnant woman, it is same as it is for any other adult. But there a word of caution, because your doctor may not prescribe you the vaccine, so be beware of that. The last I would finish, embarking on the mental health, and this is a statement from a psychiatrist in New York and a clinical health psychologist from Cleveland Clinic. They feel that working women traditionally experience higher levels of burnout compared to men. The pandemic appears to have widened that gap, with the divide now being 36% for men and 51% of burning out for women. Reason being, men are better at focusing on one task at a time, while women are multitaskers. You girls, you women who are working in banks, you seamlessly manage work, family, kids, and other obligations in life also. So it is very important to give a sympathetic hand to all these working women who manage so many things, who get tired at the end of the day more than what men do. And with this, I end my presentation by quoting Rudyard Kipling, saying God could not be everywhere and therefore he made mothers. I thank you for a patient hearing, and I have questions. If we have time, please come up with your questions. Thank you very much.
Thank you, Dr. Majumdar. Thank you, ma'am. That was truly a very, very enriching session for all of us. Personally, for me, I found it very, very useful. I think you have answered all questions and doubts that we women may have had in our minds. Thank you, ma'am. Thank you for all the valuable tips. A message for all the viewers. Thanks, ma'am. A message for all the viewers. If any of you have questions, please type in at our chat box and we will address them at the end of this session. We have one more guest speaker, and after that we will take the questions. I think we'll pause here for the first poll.
No, ma'am, please carry on.
Okay, fine. So now I would like to invite renowned lifestyle nutritionist trainer and motivational speaker, Ms. Smita Shetty from Mumbai, to speak to us and guide us on nutrition, diet, and a healthy lifestyle. She will also share some motivational tips relevant to the current times. Over to you, Ms. Shetty.
Thank you so much. Thank you so much, Banerjee, Ms. Banerjee. It was wonderful being here, and thank you, HDFC, for having me here. I'm so happy to connect with all the mothers on this special day. There's this saying by Dr. Kamath who says that a child gives birth to a mother, which is really true, right? When a child is born, automatically mother is born because she becomes so conscious about her child all the time, isn't it? In fact, I would like to add more to this. It's the time, the patience, and the love that she gives to her child makes one amazing mother, right? Since I come with a background of combining goodness of ancient wisdom along with the proven scientific principles, I would like to touch upon a couple of stuff. One is that traditionally it's not just the mother who gives birth is considered mother, but also the one who nurses and Mother Earth. All of us work as become a combined force and become a strong mother. So in our family we call grandma, traditionally we call her like she's extension of a mother. We call Masi, in fact even mamas, right? So they also give us enough love, equivalent love to mother, but of course nobody can come close to what mothers can give, right? So what is it, do you think that in olden days motherhood was much easier than today? What do you think? Are you thinking yes? Are you thinking no? What do you think? Well, the answer is yes, because actually the answer is yes and no both. First, let's see what it is about yes. So yes, because families would be staying together, though families would be like a joint family, right? So a mother would get her own me time. And child would be born like will be taken care by everyone, and that is how the child has been brought up. Like there is a kahavat which says ki ek bacche ko bada karne ke liye pura gaon lag jata hai, right? What does it really mean? Because there's so much demand from the child's end that there we need a support system by which we can keep growing. Now, why do you think it is not in very ideal situation? Is because mother completely loses her identity, right? In olden days it would be very difficult for mothers to have their own identity, right? But however, we have seen extreme beautiful mothers who have focused not just after the child is born, but also while they were carrying the child in their womb. So we hear stories from mothers who have given birth to like Shivaji Maharaj, or Subhash Chandra Bose, or even today Musk, right? All of these people, if you listen to his mom's interview, it's amazing that what all she has done when she was bringing up this incredible child, and who is today the richest person of the world, right? So yeah, this is what it is. And let's quickly discuss that what are the challenges which current mother faces. Okay, what do you think? What's coming to your mind, right? One would be definitely time management, right? Two, when it comes to food, not sure what has to be given, what not has to be given, totally confused about food. And the third one, I think, parents are constantly, mothers are constantly thinking that, am I parenting my child in a right way or not? Right? However, I personally know so many amazing mothers who have managed to balance all this out and brought up an amazing, healthy, loving, and responsible child. Yes, the focus should be, while you are bringing up a child, to make a child a responsible child, because today our children are our future. They are the ones who are going to continue your legacy and world's legacy and continue making this world a beautiful place, isn't it? The two name which that are top of my mind is one is Lina Nair. Now she is a global HR head of HUL, and Subbalakshmi Chakrabarti, she's a banker. Amazing mother I've been seeing since the kids were tiny, and now they become a responsible adults. And the way they have bought, they are working mothers, but they balanced it out, and made sure that the kids are growing up well. And one special mother who I've personally worked with is Modita. Okay, she made a conscious decision to give up her corporate life. She was amazing. She was doing excellently well in her corporate life, and became like a mother. Like she wanted to give complete time and attention to her daughter. And yeah, since the child was as young as 3-year-old, she started making her own choices when it came to food, and all of these happen when mother really focus and try to give what they really want to give, right? Well, which one is better? Which one do you think is better? Working mother is better, or a mother who chooses to be at home is better? Both are amazing. Okay, both are amazing. You know, when the problem starts when a woman starts feeling guilty. The moment she starts feeling guilty, oh, I'm working, I'm not giving enough money, enough time and attention to my child, so let me compensate with something like money and luxuries. Okay, while a mother is thinking, oh, you know, because I chose this, I cannot go out and work, and people think that I'm just a, you know, just a mother and do nothing, right? Isn't it weird, right? You know, the society pressure will always be there, mothers, always there. But what we have to make is, what we have to choose is that we are constantly making, we are choosing not to feel guilty. Okay, guilt is something which kind of pulls us down and ruins everything that's beautiful, whether you're working or non-working. Yeah, cool. So today, you know, I am going to focus, you know, like top 3 things I said: time management, not sure what to eat, what not to eat, what to give to my child, what not to give, and confused about parenting. I'll be focusing on what to eat. All right. Well, I understand that, you know that there are crazy and unlimited knowledge which comes through our WhatsApp and Instagram and all kind of social media platform, isn't it? Like, ye khana chahiye, ye nahi khana chahiye, this is good, this will increase the immunity, this will decrease the immunity. Oh, you know, if you eat this, and you are like, okay, one second, yesterday you said chocolate is good for my health because it has a lot of antioxidants, and today you're saying chocolate is not good because you know, it has a lot of sugar. So, you know, we are constantly confused and not sure that what to really eat, by which I am going to feel happy and healthy and safe in my own body, isn't it? Right. So you know, please don't get carried away by what you see, but have faith in your own tradition. The problem is that today even traditional knowledge is getting lost. You know, nobody's right trying that conscious effort to preserve it or to continue with it. We should know that these knowledge, the knowledge which we get, this knowledge is actually it's, you know, it's टाइम एंड टेस्टेड एंड प्रूवन, मतलब इसके आगे कुछ नहीं है. अगर बताया गया है कि गर्मी में आपको ये नहीं खाना है तो नहीं खाना है. And of course then modern science comes and says, yeah, you shouldn't eat this because it's going to be harmful. Like, for example, let's take papaya. You know, in this season, in summer, you should not be eating papaya, right? But you will be coming across a lot of articles which says just eat ample amount of fruit. In your head, when you think about fruit, even papaya comes as a fruit and you want to eat your papaya every day, right? But our Shastra says, the traditional wisdom where the food wisdom comes from, it says that you shouldn't be eating papaya in month of April, May, and May, June, like a month in between. You shouldn't be eating it at all, right? So these are the knowledge. In a sense, we have amazing knowledge which is stored, and all we have to do is explore it. Go back to your grandmoms and ask them that what is that traditional food, what we used to eat during this time, what we used to have during summer, so that our body is doing good, it's cool, and at the same time we are able to give best to our family, right? So if you're confused and you don't know where to really start from, you're not sure, oh god, but ye sab kahan se hum dhoolenge, kya karenge, then just remember three things, guys, mothers. One, you know, start from having local food. Bas local. Do not think about chia seed or avocado. Nahi, aap ekdam local khana khaiye, local khana, right? Number 2, eat seasonal food. जो सीजन में आएगा वही खाओ, और थोड़ा सा बत्ती जमा, मतलब बत्ती को whatever ऑन करो. व्हाट कि आप, वाटरमेलन है, वो गर्मी का फ्रूट है, वो सर्दी में बिक रहा है, तो मुझे खाना चाहिए या नहीं खाना चाहिए? That is very important. Just little bit of common sense when we start using, we'll realize that, you know, it is not so tough. It is really very simple. The third and one of the most important is this, that eat freshly cooked meals. Eat freshly cooked meals. When you eat happy fresh meals, your body feels happy, you feel happy. You know, our traditional wisdom has always focused on this. In fact, you know, to quote, you know, in Bhagavad Gita it said that, you know, food which is cooked for more than over 3 hours, we should not eat it at all, right? Because every food comes with its own quality. For example, when you eat dal chawal, how do you feel versus when you eat pizza? Probably that moment you're feeling very happy, but the next morning when you are, you know, in the washroom, you know how difficult things can get, right? So we have to understand this, that, you know, we have to understand that freshly cooked meal is so much important. Now if you're making pizza at home which is freshly cooked, yes, you can have it, no problem at all right? So let's just quickly discuss what to eat in this season and what not to eat in the season. When it comes to grains, barley is one you know, grain which you must eat in this season. So try and source barley. Barley is very good to cool the body, especially the heat. मतलब बॉम्बे तो बहुत गर्म है, बहुत ह्यूमिडिटी है, कैलकाटा बहुत ह्यूमिडिटी है, ऑल द कोस्टल लाइन नॉर्थ सब जगह पे अभी इस वक्त बहुत गर्मी है, राइट? तो इस वक्त one of the best food to eat is barley. The second one is you can have jawar, you can have rice, you can have makka. You know, makke ki kili, you can, that is, you know, popcorn, you can have that. What you should not eat, what should you not eat is, you should not have bajra and you shouldn't have old wheat. Yeah, so go easy with roti and chapati and paratha, but you can have jawar roti and stuff like that. What are the dals which you should eat is moong dal. Moong dal is very cooling for the body. You can have chana, but the one which you should not eat a lot is urad dal. You should try and go easy. Masoor dal, you should go easy. And kulit, I don't know whether you understand kulit, horse gram, you should go easy. All right. Yeah, so when we come to say veggies, what should we definitely have? It's common sense that when it is so much of heat, we should eat a lot of water-based vegetable. Not a lot of people really like it, but it is amazing. Like for example, lauki, petha, that is white pumpkin, yellow pumpkin, you must have it, and kakadi is again water-based vegetable. What you shouldn't eat at all is winter vegetable like methi, bangan, gobi, flower, cabbage, carrot, you know, peas. ये प्लीज मत खाइए, स्टोर करके रखा है रेफ्रिजरेटर में तो भी मत खाइए. This is not the season for it. Okay. Well, what are the fruits you must eat? In Calcutta we get one of the best बेल शरबत, right? और वो गर्मी में ही मिलता है, तो इसलिए आप, we must have बेल शरबत in the season. Santra is another fruit which you can eat. The one fruit which you must avoid, I've already told, like papaya, you shouldn't be eating in this season, but you can have watermelon, muskmelon, you can have amla, you can have kela, anjeer, matlab, not dry fruit, but anjeer, coconut, mangoes, you can eat aram se. All right. When it comes to that, you know, what are the masalas I must eat? You can have jeera, dhania, you know the soft neem का पत्ता जो आता है, जो नीम आता है नीम प्लांट में, इस टाइम पे गुड़ी पाड़वा जब न्यू ईयर सेलिब्रेट करते बैसाखी वगैरह, तब जो नीम का जो सॉफ्ट पार्ट होता है उसकी ना चटनी बनती है या उसकी सब्जी बनती है. तो दैट ट्रेडिशन वी यूज्ड टू ईट बिकॉज what happens is in during heat there's a lot of pith which comes up right in our body, and these are the food and vegetable and masala which kind of helps our body to tackle this issue very easily. What we should not eat, राई नहीं खाना चाहिए, मस्टर्ड का पेस्ट नहीं खाना चाहिए, ज्यादा हिंग नहीं खाना चाहिए, जो नया इमली होती है, नई इमली जो आती है वो नहीं खानी चाहिए. Now what are the oil which we should be using in this season? I'm talking only about summer, okay, because we are in summer right now. What is one thing which we should you know, Ahar Shastra says that this month is also called as Vaishak, okay, in Sanskrit, all right, and Vaishak is also known as donkey, okay, Vaishak Nandan, all right. So what it is said that, you know, in this month, if someone is not eating ghee, he is actually Vaishak Nandan. So much importance is given to ghee in this season. Everything you cook should be made in ghee and no other oil. If you have to use some other oil, it can be coconut oil or max is sesame oil, but we don't use peanut oil, we don't use mustard oil, we should not use you know, of course nakli ghee वगैरह तो जाता ही है बाहर. When I say ghee, I'm talking about A2 Indian cow ghee hand churned. Okay, I'm not talking about कि मलाई से जमा करके कर लिया या भैंस के दूध का कर लिया, वो that is not what I am trying to talk. All right, and yeah, one food which you must include is buttermilk. आपके खाने के साथ या आपके खाने के बाद, but not after 3 p.m. Whatever, buttermilk first meal in the morning is also great. like अगर नाश्ते के साथ buttermilk खाते हो लेते हो तो that is wonderful, but if not आप lunch के साथ भी ले सकते हैं. And what are you supposed to be really avoiding is dahi. बहुत सारे लोगों को लगता है कि गर्मी में बहुत दही खानी चाहिए, बट दही का जो नेचर है वो अंदर जाके आपको और गर्माहट देती है. Hence, buttermilk is preferred over dahi. All right, and what you should avoid is fermented food. In general, what you should avoid is fermented food. You should avoid अगर आपको dry fruits खाना ही है तो max is manuka, बाकी सारे dry fruits avoid करने चाहिए. All right, so yeah, these were the things which I really wanted to share. What you should not do to your kids or to yourself, please do not see food as a reward or punishment. मतलब अगर आपने कुछ अच्छा किया तो आपने चॉकलेट खा लिया, बुरा किया तो आपने अपने बच्चे को पनिश कर दिया. यू नो, डोंट डू दैट. मतलब बच्चे ने अच्छे नंबर्स लाए या व्हाटएवर, आई डोंट नो, मतलब आपके लिए जो भी अच्छा है आप उसको फूड के थ्रू रिवॉर्ड नहीं कीजिए, बिकॉज दैट इज गोइंग टू हैव दैट इज इवेंचुअली इट्स गोइंग टू डेवलप इनटू अ वेरी अनहेल्दी रिलेशनशिप, okay, with the food. So it is not at all, I would not suggest that. Please don't do to yourself or to your kids. Do not see food as reward or punishment. All right, and yes, explore local food, help them to explore local food, engage them in the kitchen. उनको आप बहुत सीधा साधा काम दे सकते हो, जैसे मे बी just जो आपने फ्रूट कट किया है वो सर्व करना, या दही सेट करना, या go to some local farm where the child is learning that food is not what you see on a table. Someone is working really hard in the farm to send that food across, and then it's there on our table. This helps us to develop gratitude and love towards food, and it plays a great role in our relationship as well. One thing which I would like to really emphasize is never force feed kids. All right, if they are saying no to milk, mat peene do, kuch farak nahi padta hai. All right, give them something else which they really enjoy and love eating, right? And of course, restrict processed and packed food. It is not great, including formula food, because आप packed processed food खाते हो आपका gut आप बहुत ही weak करते हो, बहुत सारे उसमें fillers होते हैं जो हमको पता भी नहीं होता है, and that is what leads to such great craziness. मतलब बच्चों जैसे बड़े होते हैं, girls जब भी puberty reach करती है, they have tough periods. All this happens only and only because of packed and processed food. Yeah. I would like to close with, my top 5 tips while we are struggling with COVID, or we see, people whom we love, or someone who is actually suffering through COVID. Number 1, be liberal with the amount of ghee used in your food. All right. Exercise in moderation, because garmi mein it's not a very ideal time to start exercising or go heavy on your exercise. Sleep on time. This is the most underrated aspect of immunity. All right, आप जब टाइम पे सोओगे, आप रात को जो एक टाइम फिक्स करोगे उसी टाइम पे सो, and you'll see that in 2 days you're feeling healthy and better. 4th is keep gadgets away. Keep your gadgets away post sunset so that you're able to get that good sleep. Number 5, get back to your hobby, whatever you like. Please stay away from social media. It creates unnecessary fear and panic. Remember, fear is that which kills us more than actual virus. जब आप डर जाते हो, that just pulls the immunity down and it's gone, right? Also, I would like to close with this one thing. Remember, right food, okay, right food, whatever you think is the right food eaten at wrong time does more wrong than right. I would like to repeat it again. Right food eaten at wrong time does more wrong than right. All right, thank you so much. Thank you. I'm very glad and I'm grateful to be here, and happy to share whatever I could share in such a short time. In case if you guys have any question, feel free to get in touch with me through my social media platform. Thank you so much. Thank you, Ms. Banerjee.
Thank you, Ms. Shetty. Thank you, ma'am. It was lovely listening to you. I think everything that you spoke about are so relevant, and also you've said it in such a simple, easy to understand manner. All of us women have been able to really relate to it. Thank you for those wonderful diet trips, and also for sharing some very powerful message on parenting as well. Thank you so much. Thank you, ma'am. Finally, we have come to our Q&A session. We have a couple of questions, so we would like to just address those questions. Dr. Majumdar, if you're there, ma'am, there's one question for you.
Yes.
Yes, ma'am. What are
Yes.
the safety measures for asthma patients, and also how to boost their immune system?
All right. So this is in the COVID era that you want to know how to boost your immune system. One thing which is very important for asthma patients is wear a mask always when you go out, and you know the seasons where you get your asthma precipitated. So those are the seasons, even in the non-COVID era, please wear a mask, and wear a mask properly so that the outside air along with pollens doesn't go into you. All what you exhale only goes out. This is one thing. Two is a little bit of exercise is very good, especially breathing exercises, and they would generally increase the immunity of your lungs. And rest of all is good nutrition, good sleep, and just a just adequate exercise is good enough. There's too much going on zinc and vitamin C and vitamin D as immune boosters. I don't think that we really need to embark on these so much. People are going crazy about it. It has become a common name on every prescription to every person who's either suffering from COVID or not suffering from COVID. So I feel that immunity boosting can be done by proper diet, fresh food, as we just heard, and regular exercise. And asthma patients all the more require this.
Sorry, right, ma'am. So in fact, the next question was on intake of vitamin D, whether vitamin D intake will help women in fighting COVID.
This is,
So I
all
think,
on the social media has been hyped so
yeah.
much. Vitamin C, zinc, and vitamin D. People have been taking 60,000 units of vitamin D on a daily basis, whereas more than 6 lakhs of vitamin D inside your body becomes toxic for your body. And vitamin D is not excreted in urine or stools. It is a water soluble vitamin. It stays there for months together. So please see, if you need vitamin D, definitely take it. And we Indians are a lot deficient in vitamin D, I agree. And therefore, a reasonable dosing is important. Maybe once a week, a sachet of 60,000 for 10 weeks is the standard protocol we follow. Go in for that only. Excessive vitamin D is being advocated on social groups, which I don't think is anything physiological to give.
Okay, right, ma'am. One last question, ma'am. There is, while you have answered it briefly in your session as well, any additional safety measures for pregnant women in COVID times?
Uh, Wear a mask at home. Your husbands generally tend to go out often. All my pregnant patients are falling sick. And this is only because you sleep in the same room, you eat with your mask down, and when you are eating, then you generally tend to talk also. So there is a lot of aerosol generation. So all pregnant women should wear a mask at home, I feel, because other members of the house do keep going out and coming. Even if they wear mask outside, if they've contracted the infection, it is the whole family who's getting affected. And if you have enough space, sleep in a different bedroom. Do not let the other person breathe on you. It's not now what you breathe out, it is what you breathe out in the air. Just take an example of a cigarette smoke. If somebody smokes a cigarette in a bathroom and moves out, you go into the closed bathroom, you would smell the smoke even after 4 hours. The virus lingers on in a room the same way. So have the exhaust opened, let the aerosol go out of the room. It is then when you are safer only. So pregnant women should wear a mask at home, especially even with their husbands who keep going out, or if they have other members in the family, brother, father-in-law, mother-in-law, whoever goes out and comes home, ask that person to wear a mask, otherwise you wear a mask. Don't eat together, eat at different times.
Right, right. Yes, ma'am. Uh, okay, with that, I think we have come to the end of the program. A big thank you to Dr. Abha Majumdar. We are truly grateful to you, ma'am, for taking out time of your busy schedule and speaking to us and advising all the mothers on this program on overall health and wellness. I know for sure all our viewers have found it extremely helpful and useful. Thank you, ma'am. Thank you, Ms. Smita Shetty, for your motivational words. Thank you once again for guiding us and sharing such useful tips on health and lifestyle. Thank you. And above
you.
all, a big thank you. Thanks, ma'am. And above all, a big thank you to our esteemed customers, the incredible super moms who are with us today. We thank you for taking out time and attending this webinar program. Please feel free to share your feedback. We look forward to engaging with all of you again very soon. And your suggestions and feedback will help us to organize many more such interesting sessions for you in the future. Thank you once again.
Thanks,
Take care.
Anindita.
Stay safe.
Thanks, Anindita, for having me over on
Thank
this
you so
platform.
much.
All right.
Thank
It
you
was a
so
pleasure,
much,
ma'am. Thank you.
once again. And thank you, Saurav. Thank you, Ms. Banerjee, for coordinating. Thank you so much.
Thank you. Thanks, Ms. Shetty. Thank you.